All right, well, good morning, everybody. Thanks for being here. We're joined by a number of our county legislators here in Rensselaer County. Also, my good friend Dan McCoy, Albany County Executive, our Health Commissioner, Mary Fran Wachunas, and the Executive Director of New York State Association of Counties, Stephen Aquario. Certainly appreciate everybody taking the time out to be here this morning to talk about what we think is a very important new local law that we passed here in Rensselaer County with the help of our legislators, and this is the Rensselaer County Prescription Opioid Safe Disposal Law. And in essence, what we think is this is a law that has the potential to be adopted statewide, which is why Stephen is here and Dan is here in leadership roles, and we certainly appreciate that. We think this can be adopted statewide. And what we've done here is come up with a local law that requires any pharmacy, whether that's a hospital or retail pharmacy, any pharmacy that is dispensing opioids to include a safe disposal product like Deterra. It does not have to be Deterra. This is a very good product, but it does not have to be this, in with the prescription. So as it's dispensed, they will have to, by law, dispense this along with the opioids. As we all know, we have a severe opioid addiction problem not only in this county and in this region and in the state, but in the entire nation. America dispenses more opioids than any country in the world. We're losing far too many people, and they are far too accessible. And we see it all the time. Our take-back boxes throughout the county, throughout the state, fill up very rapidly. People do want a way to quickly dispose of these to keep them out of the hands of kids, out of their households. And what this product does is you can put a significant number of opioids in that bag, add some water, shake it up, and you can safely dispose of your opioids in a landfill. So it's another step in the battle against opioid addiction. And as I said earlier, I think that we can see this get adopted by many counties. They've expressed interest in this already. We talked about it at our NYSAC meeting recently. It's something Dan and I learned about on a trip to Washington, D.C. And when we saw that, we thought this is a great product and a great idea. So that's the gist of what we're doing here today. And I just want to turn it over to my friend Dan McCoy for a few comments. Dan?
Thanks, Steve. I commend you for your leadership. And one of the things when you came on the scene was we were faced with an opiate epidemic, right? And we were controlling it. In 2019, from 2019 to 2020, we went up 60% of people passing away from opiate. And if you look on a national level, it went up 66%. And you look at all the people that lives have passed away because of prescription drugs. In fighting it, not just on a national level, being President of County Executives of America, and we've had this litigation going on, which is all coming to an end, and trying to change the cohesiveness of the way we give prescription drugs out. I have to say to Steve, when we saw this demonstration, he jumped right on it, and he goes, we're going to fix this. He goes, I'm going to make it where pharmacists have to put it out. And we looked at a variety of people that do get rid of prescription drugs, and I said, here, you know, joking around, I go, being a dad at that point, with, you know, I have 3 children, but 2 that were still at home at that point in time. I go, you have a party at your house. You can tell if there's liquor missing. You can tell if there's beer missing. But who counts the prescription drugs in the cabinets? Who goes in there and goes, was there 10? Was there 20? I thought I only used 10 out of the 30. You don't even think about it. And that happens. And if people go into your bathrooms, they go through your medicine cabinet and take your prescriptions. You're not aware of it. Or if you get prescriptions and you don't use it, it sits in your medicine cabinet, and what do? You flush it down the toilet. Or you throw it out in the garbage or down the disposal, which is not friendly to the environment. And Steve, like you said, we're not pitching one against the other, but Deterra, that takes the drug and it dissolves it, and it's environmental friendly. And that's why I commend Steve Aquario from NYSAC, who vetted through different ones, and he looked at this, and this one is environmental friendly, where it dissolves it, kills it right away, goes to the landfill, and it's not going to get into our waterways, into our sewers, into our oceans, to our water. So again, I commend Steve doing his executive order. So as we move forward, We're going to be doing the same thing in Albany County. Steve and I have been going back and forth for a while, and they passed over here to Steve McLaughlin as the county executive, to his I was going to say Albany County legislature, to the Rensselaer County legislature. I commend you for passing this. I reached out to Chairman Andrew Joyce to do the same thing, and today I did sign to after what Steve and all the work he did over here, we did do an executive order in Albany County doing the same thing, and now I'll be looking for a partner in the Albany County legislature to do the same thing Rensselaer County did, and I want to commend them. And one of the things that Steve Aquario and I were talking about, he's like, hey, remember how we started off our week? And I'm like, I can't remember what I did yesterday, let alone the beginning of our week. But we sat down with Albany Med and with Dr. McKenna, not just on the Delta variant and what's going on, but we talked about all this litigation and how we have to change what we're doing going forward, and one of which is opening up a pain relief clinic, because there's people that have chronic pain, and to address that pain and to address other alternatives than opiates. And as settlements come in and we start settling, and it's going to take a while, so I just want to say to the viewers out there, this is going to take a while. It's not going to happen overnight. We've been working with Joe Rice from Motley and Rice and a variety of other people. There's a lot of steps that take into play, but there's going to be money coming into the state, and it's not going to be tax dollar money that's going to pay for something like this. It's going to be the opiate settlement money that's going to end up paying for packages like that. So, but again, it's going to give us more resources in our arsenal to really help change not just the environment and the way we get rid of prescription drugs, but how we're dealing with prescription drugs going forward. So to Steve McLaughlin and his team, thank you. It's been a great partnership. I can't believe it's almost been 4 years, right? Yeah. I'm like, where's the time go? And, you know, really hitting the scene, not just on the national level with us at County Executives America and with New York State Association of Counties, but doing things to make a difference in people's lives, and that's what it's about to the Rensselaer County Legislature and to Fran. It is. We do, you know, we all got to put our heads on our pillow at the end of the day, and we want to do the best that we can. And Steve, thank you. And Steve Aquario, you're going to introduce Steve?
No, you can. Go for it.
Steve Aquario, who is our director, our extraordinaire, our president, whatever we want to call you at NYSAC, New York State. Well, let's not push it. At New York State Association of Counties. He's been a leader, not just on the COVID-19, but on many topics. And I know a lot of people just see an aspect of our lives and see it a little bit more because of COVID-19, but there's so much the county does day in and day out, and not, you know, dealing with the state government, the Senate and Assembly and the governor's office, and everything else. And Steve, you've been there for us, you continue to be there for us, and you've been a great partner, so thank you.
Thank you, County Executive. Thank you, County Executive McLaughlin, County Executive McCoy. These are two powerful things that we're hearing about today. This is why I'm here. I'm a statewide advocate representing the counties of New York. Today, we see the leadership of County Executive McLaughlin, members of the Rensselaer County Legislature stepping up and demonstrating how we can act and how we can change behavior. We have a public health crisis in this state. COVID-19, the COVID Delta variant, but we also have a public health crisis in substance abuse, an opioid use disorder, and that's what we're seeing right now in litigation that's pending on Long Island with Nassau and Suffolk counties. The state's Attorney General, Letitia James, bringing a case, the counties of New York, trying to change behavior. And we have changed behavior. We've changed how opioids are being prescribed. We're no longer seeing people come out of a hospital after major surgery with a 30, 60, 90-day supply of opioids. We're not doing the smiley faces anymore and pick which face you feel. We did that. These county executives changed that behavior in the medical profession, and today's example and today's local law passed by Rensselaer County is a statewide model of what local governments can do to help people with substance abuse problems. I commend County Executive McLaughlin, County Executive McCoy, and all the counties around the state trying to address a serious public health crisis. Thank you.
Thank you, Steve. I just want to make sure that we recognize, acknowledge the legislators that are here today. Kelly Hoffman is here. Kelly's in the medical field, so she understands this extremely well. Tom Grant is here. Bob Loveridge, and Dan Casale is here as well. Was Scotty Bendet here? I thought I saw Scotty. Maybe not. No, so, okay. But we appreciate their being here. We couldn't do this without the legislators' help and support, so we're certainly very appreciative of that. This county, as does Albany County and really every county, it was Tip O'Neill who said, all politics is local. This is what local politics is about, looking at a problem, seeing it, and saying there's a way to fix this or help fix this problem. And when you go away to meetings and you have these conferences, you pick up best practices. So when we saw this, we thought this is a best practice. This is something we want to do. This county has taken steps throughout this pandemic. The focus has been all pandemic all the time for much of the public. But for a county, any county, and for Steve Aquario with all the counties, it's been about not only COVID, but about keeping the county train on the tracks, keeping government going. And part of the problem that we were dealing with, and Mary Fran's going to address this in a second, was the opioid crisis did not stop. And in fact, in some cases, it got worse, not only here, but throughout the country. We had one day, I think it was last May, where we had 17 overdoses in a day. It was a bad batch of stuff out there. These are the things that we want to try to prevent, to get it out of the hands of people, get it safely disposed of. This is a county, I don't know a county that does not take this serious. Every one of us does. We took it so seriously that we're literally delivering Narcan door to door for those who need it. We got national recognition for that, but that's not what's important. What's important is to get the Narcan into the hands of those that need it. So anybody watching, if you fall into that category, you know somebody that needs Narcan, you can text the word Narcan to 21,000, 21000. Just text Narcan, and we will deliver that, no questions asked. So I want to bring up our great health commissioner who has been by my side from day one of COVID and many other things, Mary Fran Wachunas.
So good afternoon, everyone. I just want to say really a pleasure to have a boss as County Executive Steve McLaughlin. He really takes an issue and moves it, and especially to a local level. Us, the public health directors and commissioners across the state, have been dealing with COVID in 2020, but alongside of it, we did not lose sight on our opioid problem. We certainly saw great amount of death in our county last year. 50 people did pass away, and that was about almost, as County Executive McCoy said, about almost 60% up from the year before, and it was really concerning. So all these different ways of us to get methods and tools out there to people to make good decisions on what they do with their prescription drugs, their any illegal drugs, any of those, to get them off the street is really, really important. Back in 2016, the Commissioner of Health said, this is a public health issue, and every single county across the state took that very seriously and developed a lot of tools and initiatives within their counties to really combat that. And we all thought we really had a good handle on it, and then COVID came. And when COVID came, things changed. With that isolation, quarantine was a good thing to stop a communicable disease, but it was not a good thing when people have substance use disorder. So we had to change things up, and that's when we came about the Naloxone Now, and to at least get Narcan out there. We couldn't do our big community events that we normally do to get it out, so we did a couple of different initiatives. So this one in particular is wonderful because it really is going to get this D-Terra bag out to people that actually get opioids and be able to get that instantly unused prescriptions. We have a lot of take-back days. I'm sure Albany County has a lot of take-back days, but we have to wait, right? We build up our prescriptions and we wait, and they're still in our cupboards, and our kids can get to it. This way here, it's instantaneously, which is great. You can get rid of them right away. So we also, when we do our Narcan out to the public, we do bring these bags also, and we try to tell people, to please use them and not put those illegal drugs out into the streets. But this one is really hitting home with the prescriptions that people get at pharmacies. So it's a great initiative. I'm really excited. I'm really proud to be Rensselaer County and the Capital District. We always seem to come together, and NISAC's always behind us with that support. So I really thank you today.
Thank you, Mary Fran. Any of our legislators who helped pass this, you guys want to speak at all? You sure?
Just want you to know that we're committed to support this endeavor, and we appreciate the work that you've done in that.
Thank you. Appreciate that. Thank you. So just in closing, it's a terrific law, and none of this happens with one person. And we do all work together. I think sometimes the public misses that. Dan and I talk a couple of times a week. When we were short on PPE, Dan McCoy stepped up and said, "I'll help you out." Sent some over. We go away, we meet, we talk, we have things that we're talking about, and we may come at it sometimes in different ways, but we're trying to get to the same place, which is to make our counties better. And we do work really well together. All the counties do, and that's thanks to the leadership of Steve Aquario. And I think the county executives do work together regardless of their political stripes. I think the public needs to know that. There's a lot more cooperation than people would think, and a lot of things go on that the public may not see, but we are always there to help each other out. Dan does things, I say, that's a good idea, we're going to do that, and I think we do things, and they say we're going to do that too. So it all works together very, very well. Nothing works with one person. So I'm thankful to our legislators, Steve Aquario and his staff at NYSAC, always there to help the counties, no matter what, always there to help out the counties. I bounced this law off of Steve early on. I said, this is what I'm thinking about doing, and we did it. And it's nice to see it come to fruition and get enacted, and to work closely with Steve and Dan and all of the counties. So we'll certainly take any questions anybody has, but we certainly appreciate everybody being here today.
I have a few clarification questions.
Sure.
60% statistic that you gave, where was that? Albany County, Rensselaer County?
Albany County. It was Albany County. From
And that's-
2019 to 2020, and actually we're probably going to break that record this year.
So 60% increase in opioid use? or
Opiate deaths.
deaths?
Deaths. And on a national level, it's up too.
And when were these laws signed?
This law was just signed a few days ago, or late last week, which is Thursday, I think? Thursday? Yeah.
Yes.
What
Yeah.
about in Albany?
I did an executive order today, and I'm working with the chairman's office to have our legislature do it. When Steve was working on it, we're going back and forth in a partnership, so they did it first, and then I was following their lead.
And when do you expect for both counties this to actually be rolled out into pharmacies?
For us, it's enacted, right? Where ours is in action now, once it was signed.
Oh, they already have them?
Well, they should be getting them now, and we're certainly going to notify so that there's no we didn't know about it type thing. Every pharmacy is going to be getting notified of it within the next couple of days that this is what the law now requires. It is, and we'll certainly give them a week or so to get the bags in. Some of them have them, by the way. There are some pharmacies out there that said, well, we certainly will give them if people ask. That's not enough. So I think most pharmacies have this type of product, on hand already, but it shouldn't have to be incumbent upon the person who may be in pain, may have just had surgery, may not be completely okay at that point, or else they wouldn't be in that kind of pain. It shouldn't be incumbent on the person to think about it. It should be, you got the opioids, this is how you dispose of what's left. So I don't think it's a heavy lift for the pharmacies at all, and I think that they're conscientious enough that they're going to be fine with it.
And they're not funding this, correct?
They are funding this. This is, yes, the pharmacies, yeah. The pharmacies can fund this. It's not, wholesale, these things are not that expensive, and it's not a lot to ask to keep your own customers safe and the county residents safe.
What about in Albany County? Pharmacies, are we finding them?
So right now, the executive order is standing that they, the litigation coming from the opiate money coming in from the state, we're going to use that and money we have coming in to offset it. Because we did get a lot of pushback from our pharmacists that were saying it's another cost to them. Huh? Oh, I'm sorry. It was another added cost to them that they didn't want. But like Steve said, when you buy mass quantities of whatever you want to use to dispose of these drugs, it's not a big cost to them. But part of the lawsuit money coming in, because I've been sitting at the table in Cleveland and down in D.C., it can be used for this. So we'll use this to offset it with treatment and other things, and working with Albany Med on bigger programs that we'll be announcing.
Can you tell me how these deactivation products work?
Yeah, sure. Basically, this product and others like it, you simply open it up. Do we have one open, Steve? I think we did. We can actually show you.
You can open it. It's a carbon.
Slow motion. Yeah.
Carbon. Charcoal goes into the bag. County executive mentioned medicine go in there,
Add water.
add water, reseal the bag, shake the bag, and then throw away in the regular garbage in your household, which goes in the landfill,
Yeah.
environmentally friendly.
Yeah, and that's an important point that Dan mentioned. You know, any person that runs a water and sewer authority will tell you, pharmaceuticals, common sense would tell you too, pharmaceuticals in our water is not a good idea. Not only for the wildlife, but for us. So this is a way to neutralize those, and they can safely go to a landfill. It just neutralizes the opioid. Really, any medication is going to do it. It's going to neutralize it, but it's very important on the opioid front to neutralize that, so that even if you did this and you added the water and you shook it up and somebody got into those pills, they're no longer opioids.
13 at noon. Well, now Tropical Storm Henri put a damper on our weekend plans. Bob has your first warning forecast. Also coming up.
Colony police are investigating after a man was killed during a crash. I'm Sam Hester here at the Colony Police Department. What the lieutenant is telling me about this incident.